Figures from the Ministry of Health indicate that 266 people are infected with leprosy across 13 districts, with the most affected being Luweero, Nakaseke and Kumi, among others. At least 6% of those infected are children below 15 years. Luweero is among the most affected districts, with 50 people on treatment, 9 of them from the same family. Matia Ndabitai, a resident of Rutoma in Chuchusa sub-county, has lived with leprosy for the last 6 years. He can't recall how and where he contracted the disease.
The causative organism of leprosy is a bacteria which we call Mycobacteria leprae. So this is a disease which affects the skin. We take the disease of the skin, but eventually it affects the nerves.
It started as a small mark on the stomach, but later the whole body was affected. He visited a number of health facilities before he was told he had a disease he had never heard of.
Symptoms like getting a skin punch, a skin lesion which does not pain and it doesn't itch. People are there in the community, so they call them ringworms, they call them oluwumu. But before you say it's oluwumu, go for examination.
Ndabitai has been taking his medication daily, but there is not much change. The disease has paralyzed his toes and fingers. Many times he gets burns. Eight other people in Ndabitai's family have leprosy.
Absconded from treatment, so that's how he came to spread to all other members in the family. The daughters, the son, plus even his brothers. And we are putting that family on surveillance. We know more other cases are going to be identified from that family.
Rebecca Nampa's home is a few meters from Ndabitai's home. The disease has paralyzed her right hand. She's on her second line of treatment and tells NTV that she works hard to ensure that none of her children gets infected. Ronald Mubiru, the leprosy focal person in Luweero district, says it's an airborne disease caused by a bacteria. Contact with an infected person can also spread the disease.
Eventually, it may start as a small punch, but it goes on increasing. Then finally, the nerves are being affected.
Leprosy paralyzes body parts, and in its advanced stages, the infected person can lose body parts like fingers and toes. Mubiru says they closely monitor the infected people to ensure adherence to drugs to reduce new infections.
Following them up, we go to their families and we follow them up. And we also do visit, especially this family. There is a team which comes from ministry, combined with a team from the district. We go there after 3 months to visit and we re-examine on this family.
Ndabitai and Nampa say they have not been discriminated against, and this gives them hope that one day they will overcome the disease, which many consider a curse.